Well, I think the next steps are really pretty diverse. There's a lot you can do. The most straightforward next step is to really gain a better understanding of how the drug is working, and just as importantly, what types of patients receive the most benefit. So we don't have those data yet. We don't fully understand the molecular phenotype of the responders versus the non-responders, and I think that'll be an important step moving forward to help us decide which patients we should use this drug for. We're also excited about the potential for this drug to bring more patients to potentially curative bone marrow transplant. Some of the preliminary data that we showed suggested that CPX-treated patients had a better chance of success after transplant than 7+3 treated patients. So that's an interesting lead to follow. I think in the future, obvious next steps will include utilizing the CPX platform for chemotherapy to combine with targeted therapies. So there's a lot of interest in exploring combinations with targeted therapies such as FLT3 inhibitors, IDH inhibitors, and other small molecules that may fully take advantage of the beneficial properties of this drug. We can consider this liposomal formulation of daunorubicin and cytarabine a new standard of care for patients with AML who have MDS-related changes or therapy-related AML. So I think it really advances the field somewhat in that regard, in that we do have a new standard of care drug that's available and appropriate for this group of patients. We shouldn't rest on our laurels and think that this is the end-all be-all, but I think it's definitely a positive step that will, I think, be a building block for future combinations that include, like I said, novel therapies that you can add to CPX-351, or even to consider in the future utilizing the CPX-351 platform, the liposomal platform, for other drugs or combinations of drugs within the liposome, including targeted therapies. So I think the future is bright for this type of an approach, and we're just at the very early stages of really understanding how it might benefit patients.